Salina Regional Health Center brings specialty care closer to home to communities throughout north central Kansas and offering virtual care for convenient at-home and at-work access. I'm Julie Getz, Director of Business Development and Physician Recruitment at Salina Regional Health Center.
Well, Julie, thank you so much for joining me today. We're going to be talking about Salina Regional's efforts to serve the entire region. One way they do that is through the outreach clinics. Why don't you talk about that?
Sure. So part of our mission at Salina Regional Health Center is to find ways to bring care closer to patients in their own communities, supporting not only patients but also the facilities and those communities at large. We currently have 14 different specialties going to 18 communities throughout north central Kansas. We cover about 10,000 square miles with our specialty outreach clinics, which again is something that is very important to us because we do believe that part of our mission is to bring that care closer to home for those patients.
And I think going there, they're not only just seeing patients maybe for follow-up care, but also doing some procedures out there, correct?
Yes, so they'll see patients for new patient appointments, follow-up appointments for various reasons. A lot of our providers do procedures there as well as some surgeries, in addition to utilize their ancillary services for lab, imaging. So again, patients can get a full breadth of their care from various specialties in their own communities. Currently, some examples of our specialties that do outreach, orthopedics, podiatry. We also have pediatric neurology, endocrinology, as well as cardiology and several other specialties that go out in the region.
Okay. Well, one other way to serve the region is through virtual healthcare visits, or V-Care, or telemedicine it's been called. Why don't you talk about that?
Sure. So virtual care has become one way that a lot of patients are seeking and expecting to receive health care, particularly in the last 4 to 5 years. Direct-to-consumer virtual care has been a huge demand for patients, and it is a very easy and convenient way to provide health care to patients that they can, have a visit with their provider from the convenience of their own home or even at work. Our newest addition in the last about 18 months to offer virtual care is Salina Regional Urgent Care. There is a list of symptoms that are appropriate for patients to be seen virtually, and so those are listed on the Urgent Care website.
Well, thank you so much for some great information, and thank you for watching. For more information, you may visit the outreach and virtual healthcare pages under services on srhc.com, like us on Facebook, follow us on Instagram and X.